My name is Scott McPherson. I'm a family physician, originally from Hastings, Nebraska, and I practiced in Lincoln, Nebraska, in Geneva, Nebraska, and did my medical school training right here at the medical center. I did my residency on active duty in the Air Force in Fort Worth, Texas, and spent 6 years on active duty, and also been in the Air National Guard for most of my career. I'm very glad that I went into family medicine because I really enjoy the entire relationship with a patient. I enjoy taking care of patients from being born all the way until old age, and all the relationship you have with them throughout that time. You know, when I enter the room with a patient, sometimes you can tell right away that there's a serious problem, and you immediately get serious with them and deal with that issue. And sometimes it's more friendly and you can just kind of joke around with the person. You really do have to kind of judge the air when you walk in the room and sit down with them and really start working with them and meeting the needs that they have. If you try to put your agenda or your plan onto them, thinking, well, I've looked at their chart, I know what they need, sometimes you completely miss why they are there. You think they're there to see you, and actually they're there for you to help them. I like the idea of academic medicine because I've spent a lot of years in private practice learning about patients, practicing, taking care of their medical needs, and using the information I learned in medical school and in residency. But there's a lot to practicing medicine that comes with a relationship with your patients and over years of experience. You don't get all that in a short time in training. So I really believed that coming to Nebraska medicine I would have an opportunity to share those experiences with the residents and with students and be able to help them learn things that they might not learn from a textbook or from school. I like living and working in Nebraska, but I've lived in a lot of other places, so I have a chance to see what it's like to live in other places like Indiana and South Dakota. I even lived in Africa for a year. But all I could ever think about when I lived in those places was what it was like to live back here. So I've always wanted to be here, and I've stayed in Nebraska for over 25 years. I like the openness of the scenery, but I also love the friendliness of people in general, and it's just a great place to be. I like being a doctor for a different reason than I went into medicine. I thought being in medicine was more about science and scientific research and that kind of thing. But once I got into training and into the actual practice of medicine, I found that I really enjoyed being involved with working with people and meeting their needs and helping them through problems and issues that they might have. And medicine has a lot to offer for our people, but a lot about medicine is a relationship with your patient.